nursing homes are full of people who are most at risk to the severe effects of COVID-19. You have the elderly, people with medical conditions, and the healthcare workers who try to help them. So getting all of them vaccinated is crucial. But Governor Greg Abbott said this week that it's not happening fast enough here in Texas. The Kaiser Family Foundation, one of America's biggest healthcare research organizations, asked those involved in the process to explain what's happening.
So as of January 5th, there have been over 130,000 deaths in long-term care facilities, and this accounts for about 38% of all COVID-19 deaths in the country.
For roughly the last year, we and our members have been working 24/7 to try to do everything we can to fight COVID, and we've been losing. The data that Priya showed are, it's just sobering. And we thought coming into the fall that maybe the vaccine was around the corner and we were going to be able to put this behind us. But the incredible spread across the country in November and December, as the data that Priya showed indicates, have accelerated the cases and the deaths in long-term care. Well, the opportunity is this. Less than 1% of the population lives in long-term care facilities. Think about that. Less than 1%. We're talking about between 2 and 3 million people. And yet, that very small percentage of our population has accounted for, as Priya indicated, almost 40% of the deaths. Just think about that a minute. 2 to 3 million people accounting for 40% of the deaths in the United States. So what is the opportunity? Well, the opportunity is if we can just get our act together and figure out how to get all of these people vaccinated, in a very short period of time, we can cut the COVID death rate dramatically. And I know there's been an incredible amount of publicity about how bad the overall rollout of the vaccine has been. I think you have to really separate the long-term care program from that, because the long-term care program has actually been going pretty well. We issued a challenge to every governor to have the second dose of vaccine in all long-term care residents by the 1st of March. And I think we have a really good chance to beat that goal. We've learned that the side effects are not nearly what were advertised. I think that we may have made a mistake in an attempt to be so transparent early on. And I think we scared the heck out of a lot of people by talking about how bad some of these effects might be. In reality, it hasn't occurred at all. And so we're really seeing a very high success rate with respect to residents taking the vaccine. Now, the bad news. The bad news is that we're having a real problem with staff. We're having a real challenge with staff. Again, we don't have good hard data, but we think that the uptake with the first clinic for staff has only been around 50%. In some buildings, it's been as low as 20%.
And so I would say, I think we have seen an increase in vaccinations, but in my area, the reason I'm seeing the increase is because local public health and other health entities have stepped up and have said, you're right, these outbreaks that we're having are placing a significant strain on our hospitals. And in order to address that, we are going to prioritize their vaccinations with the dosages that we are getting as counties, meaning that in addition to the pharmacy partnership, our counties are having to take vaccinations off the top and divert them to long-term care. And let me be clear, I think that is the right decision.
I just wanted to add a number, which is, when you think about the 500,000 cases in long-term care facilities, at the same time, there's been just almost as many sickened caregivers in that mix. There's, the last number I had was 425,000 caregivers got sick themselves from the virus, and just a little bit close to about 1,300 of those folks have lost their lives. So I just think from the workforce perspective, I want to sort of bring that lens into the conversation. Also, we know that in communities of color, Black and brown communities in particular, which are really disproportionately represented in long-term care work. Those are the workforce, that there's very real hesitancy. And I don't think there's been enough attention given to the fact of getting trusted voices and spending the time to really help folks understand, and create forums for those caregivers directly in those communities to talk to people that they trust, to get their questions answered directly, to be able to drive up the rate of vaccination. We think that's really important.
The other problem is we have a chronic problem of not being able to find enough workers for our buildings. I know there's a lot of people that want to mandate staffing requirements, and I certainly understand that. But the reality of the real world is it's hard to find people to work in these buildings. And so there's a fear among providers that many would like to mandate the vaccine. But there's a fear that if they do, they can't afford to lose a single CNA because of the shortage. And there's fear that there will be a lot of people that will be lost.